as well were also one of the key themes. And we have seen that there's been an increase of numbers of hate crimes across the country. And we spoke on the fact that the perpetrators still roam free, and they still haven't been brought to book. As much as we have a very progressive constitution, it does not translate to the lived realities of transgender diverse individuals, queer individuals. And then we spoke on the legal gender recognition, which is still an issue. Like, for example, there's no time frame that is set. Like, for example, when one changes their gender marker, like how long they need to wait as well. And also the fact that they need to prove themselves, you know, they need to prove who they are at Home Affairs, which is still another issue. And then we spoke on decentralizing gender-affirming healthcare to primary healthcare level. Like, there's a lot of things that we discussed on, and I wish that we had been given more time, and I feel that we are like really robbed of that opportunity. But on that further note, thank you very much.
I think the request to both our teams, I keep saying adolescent, young key populations, but also us as trans communities in the second track, it's going to be quite important that Comrade Jabu and Leon, we've got that feedback in writing as well, so that it can be part and parcel of the summit report, but also it gives us something to work with as we move forward to the sector summits as indicated yesterday morning, but also as the civil society forum engages in its Lekgotla, zooming even deeper on advocacy issues.
Thanks, Nhlanhla. Good afternoon again, colleagues. So I was moderating the session on the Yankee population guidelines. I think more than anything, we had a very emotional parallel session. Firstly, with Yankee populations giving their own personal experiences of being members of the various KPs. And we identified that, you know, a lot of young people still experience violence, police harassment for various reasons, rape being an issue that came up quite evidently. I think, you know, one thing as we develop, because we did indicate that, you know, it's a collaborative, multi-sectoral effort, bringing together the Department of Education, and luckily LICO could make it and be with us and present on behalf of DBE. And then we had colleagues from the Department of Social Development as well as Education joining us online, but however, we had technical glitches, and they were not afforded the platform to speak, but they have been engaged on other platforms, and we hope to engage them as we build towards having a final guideline. But we realized today how necessary and how important it is to have these interventions designed for young KP, and that they have been neglected when we design our interventions. So yeah, I think I'll stop there for now. Thanks. Oh, okay. I've been instructed. So now we're going to go into our closing ceremony. I'd like to invite two special, very special guests of ours. Firstly, starting with SANAC CEO, who is our mom at SANAC, who's really key in all of, you know, in putting all of this work together. And then secondly, I'd like to acknowledge and really appreciate the presence of Honorable Deputy Minister Steve Litsike, Deputy Minister of Women, Youth and Child Disabilities. So, DM, perhaps we can start with you, or oh, okay, CEO. All protocol observed.
Good afternoon, colleagues. Nizwile ukuthi kuthiwa Isikhathi sesidliwe yinja. So I am going to be very, very quick so that we can give DM a chance. Let me speak from riding on all protocol in terms of recognizing all stakeholders. Abakhona, igama lami ngiuThembisile Xulu. I'm the CEO of SANAC, and I'm also the chair of the Global Fund Country Coordinating Mechanism. We have drafted the NSP for 2023 to 2028 as a country. And this NSP is people-centered. Ibizwa nge-people's NSP, and therefore it is one that has to be driven by you as the people. Tina as SANAC, we commit to coordinating, we commit to making sure the collaborations that are needed happen, and as a start, we have been working with FPD towards the CSF Sector Summit, as well as the CSF Lekgotla, where we expect each sector to come out with a mandate on how they expect to support the implementation of the NSP, which means how you want work to be done for yourselves when you're saying nothing for us without us. So it must come out of those sector plans, and SANAC will make sure that we bring it to fruition, working with yourselves and guided by yourselves. I'm aware that I haven't been here, but I've been keeping in touch with the team, and the issues particularly related to sex workers, PWOD, the TG, the psychosocial, the mental health. I'm excited to say the FPD has requested a special session at the CSF Lekgotla to deal with issues of mental health. So there is going to be an entire session dedicated to mental health at the CSF Sector Summit, as well as at the Lekgotla. The issue of gender affirming comprehensive healthcare services as at primary healthcare level. I think once the reports from this session come out, we need to agree that summits can't just be summits followed by summits. Something has to come out of this that feeds into the sector summits, feeds into the CSF Lekgotla, feeds into the mandates, but make sure that the next summit, when it starts, day one is an accountability forum, which will speak to the issues that were being raised just now. And SANAC, again, commits to be the coordinator of that particular engagement. From our end, I'm not going to be long. As I am known to always say, we know that young people face very, very serious challenges in this country. And you can imagine how worse it is when you are a young key population. So I'm going to end by saying that as long as key populations remain criminalized, there will be no data for them because they will not come forward because of stigma and discrimination and violence. As long as key populations remain criminalized, universal health coverage will be just a dream. As long as key populations remain criminalized, there will be no HIV epidemic control. And as long as key populations remain criminalized, we will not stop TB and HIV as public health threats by 2030. 2030 is 6 years away, but we've got targets for 2025. And 2025 is next year. So failure is not an option. Endless talks and endless summits are no longer acceptable. SANAC will not accept the unacceptable, and we will work around the clock to make sure that no key populations are left behind. Thank you very much. On that note, I'd like to humbly introduce UDM. Those of you who were at the TB conference know that I did a sterling job with my introduction of my Deputy Minister of Women, Youth and Persons with Disabilities. DM, over to you.
Good afternoon, everyone. I'm aware that I'm between your lunch and departure. So I won't take too much time. First, to really appreciate, the invitation. I was saying to the CEO that, the National AIDS Council has not held its plenary session. So technically, I'm still the co-chair of SANAC.
Yes.
just technically. But you know, I want to really say CEO to you, to the entire leadership of the civil society forum. I know the leaders, you know, of the coordinating group, as well as sector leaders that are here, but all distinguished delegates that are here, including government officials. I've seen a few when I came here that are here. I'm really appreciative of this opportunity, but I think one thing that I really want to rehash, you know, on behalf of our government, is that key population is clearly defined in our national strategic plan. So we must actually walk away knowing that we have identified the key population. And I want to say this, we will not shy away as the South African government to accept that when we developed the national strategic plan, we defined it. One, it includes sex workers. It includes men who have sex with men, transgender persons, people who inject drugs, inmates, and also persons living with HIV, including adolescent girls and young women. And then we've got vulnerable groups that we've also included. So our NSP is intentional to its intended population. And there are some of the things, because of the approach of our behavioral, biological, social, and structural drivers, there are things that we have identified that must be key. I won't speak about the health intervention. You spend the last 2 days focusing on the health interventions that all of us, whether in civil society, in government, private sector, we must do. But I want to just lift what we need to be paying attention, close attention to, because our NSP has been instructive on it. And that is addressing the structural interventions. And that speaks about our supportive legislation and policy work that must be crystally be implemented and transforming towards supporting the work of key population. We have done it in the past when it speaks to realities of LGBTI community and others, but we haven't really gotten it right when it comes to sex workers as well as persons who inject drugs. So we must repair the injustice of the past, because no person in our country needs to be criminalized or to be defined as a criminal in any way. So we must change that reality. The second part, addressing stigma and discrimination, is very key. So let's pay closer attention to stigma and discrimination, because it may actually force us to reverse the gains. So Thabo, we do need the human rights sector to step up, and all other sectors to step up, you know, in working with government. Government, you know, is a committed government, but it can only be extremely pushed to its level of, you know, competency when it's finding expression with advocates and working with civil society. So we really do have that kind of way as civil society not to become complacent. As South Africa, we can't be found to be complacent. So we must do the right thing, and part of the right thing is advocating. And I think CEO was alluding to what are the things that we should never be relaxed around. The last 2 points I really want to make. One, it's really around community empowerment. Every intervention that we must do, community must be at the center and community must lead. We've got resources that speaks to the work, but these resources must find expression by empowering and enabling and emulating community empowerment and community-led interventions. Lastly, I know, having led SANAC, and I know what is the priority. You know, CEO, some people say we have an issue or challenge of financing or funding. The country has enough resources, including resources that are put by, you know, PEPFAR as well as Global Fund. We are just not leveraging these resources and coordinating them enough to meet the community and people's needs at where it's needed, including domestic resources. So if we actually take a moment towards plenary, and I'm forcing it because that's where the decisions are made on behalf of the council. We must actually go towards plenary in saying that this 2028 agenda, which we need to report to, which our NSP ends on, this is how we better want to coordinate the response and revitalize that shared leadership and accountability towards it. We can do it. Why? The 7th administration has just started. 2, we can show business cases everywhere in terms of our response, including the fact that South Africa will be chairing G20. All these contributors of Global Fund and many others are coming to South Africa. So what is the health agenda? I just came from C20 session now, earlier. And I'm saying, what is the health agenda? Now, Comrade Tabo, Comrade MC, you in the coordinating committee, you must say, what is the SANAC or civil society agenda for C20, for G20, for BRICS in terms of the health agenda? So how do we locate this in the right spaces? And then lastly is to say, with everything that's happening, we know what needs to be done when. We also know who needs to be involved, but we need to now coherently coordinate our efforts. So I wish all the deliberations that have happened well. We'll get the report. We will engage with the team through the CEO as a coordinator or a mechanism of the country in terms of the AIDS response and the entire team. But we need civil society not to relax. It's not time to relax. In fact, you need to stand up collectively in solidarity and fight a little bit more. That's what we need.
And on that note, we come to the end of our summit. Jabulile, with your permission, let's thank everyone, starting from the top table as our dignitaries step down. Comrade CEO, Comrade Deputy Minister, thank you so much for those last remarks as we close our summit. And of course, colleagues, we've made a couple of promises to each other in this summit. In our deliberations, we've got a couple of government departments, NGOs, CSOs, CSO leadership, but also critically, our donor agents represented by AIDS Foundation, Beyond Zero, NACOSA, and of course the National Department of Health and CDC that had been part and parcel of this conversation. The question is, the summit that was, what is it that we're taking forward? We came in with 5 key objectives, and of course the closing remarks have already spoken to those, and therefore from where we located, it's to thank you for having allowed yourselves to be here and be part of the conversations. I know time was not enough, but nevertheless, we say thank you for the little that we have. We say thank you for when we are given abundantly. So let's take what we've worked on, and let's make sure that we do not lose sight of it, and let's drive it forward. Next summit, hopefully in partnership, perhaps, hopefully, comrades AFSA, BZ, NACOSA, CDC, you'll host us next. Not so sure, let's see. But from where we are at a civil society, it's our ask. Let's not wait another 3 years to have another summit. Let's continue while things are still fresh and make sure that we bring about change. I want to take this opportunity to also thank Usis Jabu, literally heading this process, our key populations technical lead at SANAC, and to thank also everybody else that has been involved behind the scenes in working tirelessly to make sure that the summit has been a great success. Do travel safe, do enjoy your meal. Please, nobody must report food poisoning because it was just all in a rush. but our human rights to accessing food will be protected. Comrade Tabo is here to ensure it. Sis Tabo, are you feeling covered? You started very much on a nervous note yesterday morning. Are we all okay now? Do you want to say goodbye to us as we all leave?
Thank you. Colleagues, I think it's really been such an amazing last 2 days. It started off shaky, as Nonhlanhla highlighted, but really, more importantly, I want to thank the organizing committee. We had so many calls trying to plan the summit, and I'm so happy to see that it's become the success that it is. And I'm hoping that we can work together in future collaboratively for other key population summits, possibly to even have this maybe every 2 years, of course, depending on funding. I think it's a great opportunity for all of us to network and come together and to know what we are all doing in our different spaces. It's an opportunity for people to also learn. I want to thank also the speakers and the moderators of the various sessions and everybody who has traveled to be here, and also more importantly, Lerato, who has had the biggest nightmare in getting all of you here. Thank you. Meeting adjourned. Enjoy lunch.